got a neck problem. They took me into a cubicle, into side acupuncture my hands and feet, and I said, hold on a minute, I've got a natural field acupuncture. It originally comes from the US. It's an approach used to needle the ear in acute situation. NHS settings recommend the use of acupuncture for chronic pain. Western medical acupuncture is essentially traditional Chinese acupuncture.
Why do we use auricular acupuncture at the same time facial acupuncture, which is coming up?
Everything comes back to anatomy and physiology. Acupuncture can be incredibly useful for pelvic problems. Never, ever, ever, ever use acupuncture. And that's if the patient didn't want it.
Thank you for joining me on this podcast. If you don't know me, I'm Xavier, physiotherapist, and also I'm the host of Keep It Moving podcast from Kent. Today, I have a fantastic guest who's going to talk all about acupuncture. He's no stranger as a physiotherapist to acupuncture. He's been a trainer and teacher for all the physiotherapists across the globe for more than 25 years. He don't need any introduction to say that he's such a fantastic physiotherapist or an amazing teacher. He started his career as a physiotherapist, then fell in love with acupuncture, and he's now representing the group of acupuncture physiotherapists in acupuncture industry across the globe. He has wide experience in training and treating the athletes in NFL games and also the US military, and he has been all over the world teaching their fellow physios in acupuncture. He has done his doctorate in acupuncture, and also he practices the auricular acupuncture and also facial acupuncture. He has tons of experience in the acupuncture world, so I'm going to ask him as many questions as possible, but at the same time he'll return in English, very simple English, so that every patient of mine can understand why does the acupuncture work and how does it work and how it's working only for certain people, not for others. All this conversation we are going to have, it's going to be a fantastic journey. Join me in this Keep It Moving podcast. John, thank you for joining me on this amazing podcast. We're going to talk about all acupuncture.
It's my pleasure, Xavier. It's always good to catch up, so happy to talk about anything.
Oh, perfect. So, you've been amazing. You are a chartered physiotherapist, but at the same time, you are teaching acupuncture all over the world.
Yep.
And how did you get here?
So, I started acupuncture 25 years ago. What happened is I actually was at work one day and I was a physio and I had a problem with my neck, and a colleague just walked past and noticed I got a problem and asked me if I wanted some treatment, and I was like, yeah, great. So they took me into a cubicle, into side acupuncture my hands and feet, and I said, hold on a minute, I've got a neck problem. What are you acupuncture my hands and feet for? And they got, trust me, I know what I'm doing. Anyway, cut long story short, one treatment and it felt so much better, and then I was intrigued by the whole idea. And so I did a basic course, and then I went on to do a master's degree in acupuncture, and then studied a PhD in acupuncture and so on, and then that led to 25 years of clinical practice, and then I kind of happened to end up teaching because people would say to me, well, can you show me this technique? Can you show me that technique at work? And it kind of just drifted into teaching it then. So yeah, so I teach all over the world now. I teach for the NHS, and I teach for the private sector in the UK. I teach for the Ministry of Defence, physios. I teach physios in fantasy football. I teach for the FA. I also teach for what's called UKSI, which is United Kingdom Sports Institute, which supply the physios and other sort of backroom professionals to the Olympic team and so on. And then in the US, I've taught for the US military, I teach for the NFL, and so you quite a few people.
This acupuncture have taken you all over the world.
Yeah, it has. What started out as a colleague just treating my neck and a little interest in it has taken me all over the world. It's taken me to some really high profile organisations, and I have taught thousands and thousands of clinicians worldwide.
Yes, that's true.
And it brings me here as well with you guys.
You've gone all over, but you have come down to Kent today.
Well, yeah, why not? I go everywhere. There's nowhere that I won't go. If there's if clinicians are interested in learning, if patients are interested in treatment, if people want to know more about it, I'm happy to discuss.
This is a Chinese medicine to start with. Now we are using in all the Western world purely to manage pain as a musculoskeletal physiotherapist, but people do use it for various other problems as well. And how do you see a physiotherapist can incorporate normal acupuncture in their practice?
Yeah, so I suppose it's worth looking at how it works. I say this all the time. If you understand the why, the how is going to present it.
Yes.
So it's like, well, why would we use it? So we can look at the history, the long kind of like legacy of thousands of years, and we've got the whole, just sort of Chinese culture and so on to thank for that. But when we look at what we do now, it's a little bit different, because what we do now is we're looking at the underlying evidence, the underlying research and the physiology behind it. So I break this down really, really simply and say that there's 5 main reasons that we might want to use acupuncture as a physio or as a doctor or as a clinician. In the UK, this is why we might use it. So the first reason is that where we put the needle, we can help with local healing.
Yes.
So if there's been damage to the tissue, if there's some change in the tissue, we can potentially help with that healing. The second reason is that where we put the needle, we can also create a chemical response from the body that releases the body's own pain-killing chemicals. So that can be useful for lots of things. The third reason is that if you've got sort of tightness and restricted range of movement, maybe we've got back pain and the muscles are not really functioning as they should, that's leading you to have pain. By inserting the needle into the muscles, we can potentially increase the range of movement in the muscles if they're operating dysfunction. The fourth reason is when we put the needle into the muscle's got nerves in there that pick up the sensation of the needle, and it sends a message up to the spinal cord before it goes up to the brain, and that can cause a chemical release that can help block pain. And then the fifth and final reason, that signal can carry on up to the brain and it causes a release of chemicals, the body's own chemicals on the needle, but it releases the body's own pain-killing chemicals and anti-inflammatory agents, and that can help with pain, and it can also help with healing, and it can help with a whole myriad of things beyond pain as well. So 5 main reasons, and so when your physio or your doctor's doing it, that's what they're thinking. Now historically, I know we can talk about acupuncture points and meridians and all sorts of ideas, which we completely respect historically, and we appreciate that we stand on the shoulder of giants when we talk about medicine these days. But your clinician, if you're coming, say someone who's coming here to XCEL, or they're seeing their GP or whatever, and they're going to have acupuncture or suggest it, it's going to be one of those 5 reasons or a combination of those that they really want to apply to treatment to cause the change. And what they're looking for is what we would call the pathophysiology. So the pathology is like the disease process, the damage, the dysfunction, the aging process, whatever's going on there, relative to the physiology, which is the normal function. And then how do one of those 5 reasons interact with that? And so they'll then choose points that create that effect relative to your problem, and that's why they're going to be putting points all over the place as well. So it's kind of how it works, why they would use it, and where they're going to put the needles as well.
Wow, that's fascinating, and it's quite interesting as well. There is always a myth I've heard that people say that only acupuncture can be used in a chronic condition, that is pain for long term, not necessarily a recent injury which is in the last week or 2, but I have seen people using acupuncture for the acute conditions and in sporting population as well. How does it differ?
Yeah, so again, it goes back to what I just mentioned when we talk about why we're going to use it. So your like I say, your clinician, your physio, your doctor, whoever is your clinical practitioner, they're going to look at your history. They're going to look at the problem, and they're going to think about your problem as it relates to the changes that's going on with the tissue. Now, that could be acute, and by that we mean it's fairly recent, or it could be chronic in that you've had it for a long time. Now, when they look at those things, they're going to be deciding, well, what do I need to do that's going to interact with that? So, for example, I mentioned earlier that I teach for a lot of Premiership football clubs. I'm not going to name any names. No. It depends on how you feel about different clubs. I don't want to excite anyone or upset anyone in the same sort of sentence, but some very high-profile clubs. Now, they're really interested in how quickly they can change things. They're under a lot of pressure with time management to come up with the best results, and they're looking for any treatment that they can utilize to give them what they want. And so in some cases we might use it for acute problems. So when we look at, say, that reason 3, needling the muscle, that can give us a very quick change. we could have tightness and dysfunction. Maybe it's a hamstring, maybe it's the lower back, maybe it's the deep muscles of the hip. We can needle, we can create a change straight away, and then that can change pain. And so we can use things, you can have an injury straight away, we can use it. Interestingly, there's a whole approach to acupuncture where we can needle the ear as well. And again, this is based on the physiology of the ear. So influencing pain from receptors in the ear, but also influencing stress and anxiety and so on. And there's a whole system of ear acupuncture called battlefield acupuncture.
Say again, what is that?
Called battlefield acupuncture.
Wow.
And battlefield acupuncture originally comes from the US. And it's an approach used to needle the ear in acute situations. So there's nothing more acute than being on a battlefield, and help reduce pain and help manage stress and anxiety. And of course, it's used in conjunction with actual analgesics, so painkillers. But it's just another layer that can be used for acute things, because acute pain is not just pain; it's stress, it's anxiety, and anyone. Sort of watching this who's had an accident, maybe hurt their back,
yes,
twisted ankle or a whiplash, knows that depending on the injury and the situation, that comes with a lot of stress and anxiety as well. So we can use that as a mechanism for those sorts of things. So acute things, yes. So immediate things. I know that a lot of people think it's all about chronic, and of course when we look at the NICE guidelines, which are a guideline that's used by the NHS to look at what's best practice in that setting, can be a little bit different in the private sector sometimes because it's a slightly different setting. But of course, in the NHS setting, the NICE guidelines recommend the use of acupuncture for chronic pain.
That's true.
And they recommend up to 5 hours of treatment.
Yes.
Which, depending on how long you're treating for, depends on how many treatments. So if you're treating for half an hour, that could be 10 treatments. If you're treating for 20 minutes, it could be 15. And they recommend that the duration and the frequency be decided by the clinician in certain settings. So they recognise that it's useful for chronic pain. So we've got acute and chronic. The clinician, understanding the problem and understanding the mechanisms, will come up with how best to use that, really. So it varies slightly, but both acute and chronic are reasonable. With
you remind me of me to ask loads of quick questions here. What is the difference between traditional Chinese acupuncture and Western acupuncture?
So really, the I suppose the difference between the two is Western medical acupuncture, as I mentioned before, we stand on the shoulder of giants, and what I mean by that is it comes from a saying that if I saw further, it's because I stood on the shoulder of giants. So what we do is we've taken traditional Chinese acupuncture, which is why we can respect that historical perspective and the culture that goes with it. And essentially what we've done is reverse engineer it. And so we look at it and think, okay, what's happening here? That there's no traditional Chinese physiology and Western physiology, there's just physiology. So if it's working, and when we look at the evidence and we look at different studies and we see that it's working for different things, why is it working? So basically we pick it apart. So we pick apart the anatomy, and we pick apart the physiology, and we look at chemical change in the body, and we do research on this, and we try to pinpoint what's going on physiologically, what's going on with the chemicals in the body, what's going on in the real world, terms that we can equate to in the same way we would do with drug trials. We look at those things. And if we can find a plausible physiological mechanism, what we would call sometimes biological plausibility, which means that there's a chemical change, there's something happening here that's real and tangible, and we can measure it and we can get some objective data on it, then we can utilize it. And then what happens is that becomes Western medical acupuncture. It's essentially traditional Chinese acupuncture that we've taken, we reverse engineered, and by that I mean we've worked out physically how it's working. And then if we can find evidence that supports that in the studies that we do, we'll happily use it. And so that's the difference, really. It's the same points, but the explanation's completely different, and the evidence base can be a little bit different as well. But we want to make sure that we've got the same biological plausibility that we have with drug trials. So for us as clinicians, we wouldn't necessarily look at acupuncture any differently than we'd look at, say, medication. We're still looking to, what I'd say, leverage that effect. The difference with medication is the chemical change is occurring because you're putting something in you. with acupuncture, what happens is you put in the needle in, which is triggering a response, and the body is having that reaction. So it's the body's own chemicals
Yes.
causing the reaction.
So many people ask me this question too. What is the difference between normal needling, acupuncture needling, and dry needling?
Yeah, so we can break this down. If we go back to what I was saying earlier about 5 reasons, local healing, local analgesia, myofascial effect, segmental effect, and what we call the supraspinal effect, the central effect. So when we look at traditional acupuncture is needles being put anywhere in the body, potentially, to treat all sorts of things. Western medical acupuncture is needles being put all over the body to treat a variety of things that have a evidence base, so published articles, research, that we feel confident that we've got a good biological explanation for. That's what Western medical is. Now, dry needling is reason 3. Okay, so needling locally into the muscle that we think is the problem, or potentially adjacent to it. So of those 5 reasons, dry needling is primarily reason 3, maybe a little bit of reason 1 as well, which is like local healing and what we call the myofascial effect, which is putting it into the muscle to reduce tightness and pain in the muscle. What dry needling doesn't tend to do is it doesn't move away from the target to create other effects. And one of the things I talk about when I'm teaching acupuncture to different clinicians is how we can leverage effect by understanding the 5 different mechanisms and how these fit in with different conditions. So for example, you may be treated for something like back pain, and your physio might put needles in the back and then down the leg and then down into the foot.
True.
Yeah, and as a patient, you look at that, which is exactly the same as when I was first treated for my neck, all those years ago now, all those decades ago, and I had a neck problem, and they put needles in my hands, and I'm like, well, you know I've got a neck problem, don't you? And they're like,
too far away from the source of pain.
and I feel like, why are we doing that? Well, let me explain why you do that, because that kind of fits in with the difference between acupuncture and dry needling. So dry needling really just focuses directly to the area, whereas what we can do with acupuncture is we can do that as well. So acupuncture encompasses dry needling. It's just a broader scope because it's all the 5 reasons as opposed to just really focusing on 1 or 2. If we move down the leg, so you've come into the city physio, you've got back pain, they'll give you exercises, of course, which is a must, and they decided that they're going to help you increase your range of movement, the acupuncture, but also reduce down the pain. So they put some needles in your back and you're happy with that idea. And then they start putting them down your leg and you're thinking, hold on a minute, my problem's in my back. But here's how it works. What happens is, and some people who've had sciatica will recognize what I'm saying here, that the nerves from your back actually run down your legs and they go to the muscles in your legs, you know, that gives them the action, gives them the impetus to move, and they go to the skin as well to give you the sensation. So that's what we call a nerve root, and that becomes what we call a peripheral nerve, as opposed to
the spinal nerve.
So instead of being the central nervous system, it becomes the peripheral nervous system, so it's outside the spinal cord. And it runs down the leg and it branches off and it goes to different muscles and it can influence those things. Well, what we can do is if we place the needle next to the nerve, now we call this perineural, peri next to nerve. And this is what we call it in clinical practice, but essentially we're placing the needle next to the nerve, and your physio will know their anatomy so well, they'll be able to pick out these points along the nerve that's causing the irritation to your back as well. So when you've got sciatica, you know you've got that pain coming down from those nerves. And so they'll place it next to it, and that'll be reason 4, they're having an effect on the nerves in the segment. And then they might go down to the foot, and that will also stimulate the nerves, which are very sensitive in what we call the peripheries at the ends of the arms and legs. And this can have a stronger effect as well. And this can cause a release of what we call your body's own opioids, which are pain-killing chemicals. And these pain-killing chemicals can reduce pain, they can make you feel better. They're very, well, the drugs that you're given sometimes, you know, sort of opioid drugs, they mimic the ones that your body
produces.
And so what acupuncture does is it elevates your own production, what we call your endogenous production of opioids. It elevates that. So you can get the effect of the medication without actually taking medication, so there isn't any side effects from that. And so then what might happen is your physio might put the needles in your other foot. You think, hold on a minute. Hold on a minute, where are you going? But that also just reinforces the effect. They might even go up and put them in your hands as well, and then you're thinking it's gone completely crazy. But again, we do that because that creates a stronger central effect. Without upsetting things, it can create this stronger central effect, which can help elevate your body's opioid production,
Yes.
which gives you a benefit to enable you to reduce the pain, so you can do your exercises more, so you can engage with more activities that your physio will be giving you. So we use it in conjunction with say the exercise and so on for back pain. But that's the kind of the difference between dry needling and acupuncture. Dry needling, you're just going to go to the muscle primarily. With acupuncture, you're going to go to the muscle as well, but you're also going to try and encompass all those other mechanisms,
The neural systems.
to layer the effect to get the best options for the patient. So it's the bigger picture, really.
Indeed. That's amazing. This is another question. One of my patients asked me this. Xavier, why do we use auricular acupuncture, that is the battlefield we are talking about,
Yeah.
which amazingly works for other organs within the body? At the same time, facial acupuncture, which is coming up. You teach facial acupuncture, I believe.
Yeah.
And that is also quite popular among patients. Can you spend a minute or two on both of us?
Yeah, so auricular acupuncture, so needling the ear. This is the thing that people find a little bit confusing, because you look at that, you think, well, I understand why somebody might needle my back for back pain, but why would you needle my ear? And again, it's understanding the anatomy and the physiology. So everything comes back to anatomy and physiology. There's no, how can I put it? There's no sandals and candles here. There's no magic going on. It's all just anatomy and physiology and the mechanisms. So when we look at the ear's got three main nerves that go to it. We've got the trigeminal nerve, which is cranial nerves. We've got the vagus nerve, which is one of the cranial nerves as well. And we've got the greater auricular branch of what we call the spinal plexus. Don't worry about that. So the one that we're really interested in there is a special nerve called the vagus nerve. And this turns up I see in podcasts and things we talk about vagus nerve. Now, let's just go back a little bit into the physiology to understand why this one's so important to us. So your body has a system called the autonomic system.
Yes.
And what the autonomic system does, it automatically controls things. So your sleep, your digestion, your anxiety, your stress. So it has two main aspects. We have the sympathetic system, which is sympathetic to you staying alive.
Yep.
This is your fight and flight or your freeze. It's like, I don't like this, I need to run away, or I'm a little bit anxious. And so this is the thing that gets you worked up. And then we have the other thing called the parasympathetic. And this is your rest and digest. Now, we've mentioned that the nerves come out of the spine and they go down to your arms and legs and things like that. Well, you also have a nerve that comes out of the head, the cranial nerve, and this is the vagus nerve. And what it does, it gets its name from the word vagrant, which means to wander. So it wanders around the body. And because this is in hundreds of years ago when it was first dissected out in studies, they found it was going all over the place, and they're like, well, it's wandering everywhere, so that's how it got its name.
But the vagus nerve wanders everywhere.
Vagus nerve, yeah.
I thought it's going from ears to the diaphragm and your heart. That's it.
Well, no, it goes to pretty much every organ inside. Yeah. So what happens is we have it can get very complicated, so I won't do it too much. But we've got two main areas of parasympathetic effect in the body. You've got the sacrum, which is the
pelvic bone.
Yeah, so we've got the sacrum, which is in the pelvis, which is at the bottom of the spine, and this gives you the parasympathetic, so the calming effect to the bowel and the bladder and the uterus, potentially. So that calms things down. And then the rest of the nerves that run down the spine are more excitatory. So they're sympathetic. So then they go to the organs, and then we have the vagus nerve. So again, it's wandering around the body. It goes to the heart, goes to the lungs, goes to the diaphragm, goes to the stomach, goes to the liver, goes to the spleen, goes to the kidneys, goes down to the bowel. So it's pretty much going to everything. So it's wandering around the place. Now, on its journey from the brain down, it only comes to one place on the surface of the body. It does all that about the organs, but it really only comes to one place, and that's in this part of the ear called concha.
Wow.
Concha just means shell. So if we want to calm people down, This is where the battlefield acupuncture
Yeah.
comes in. So we don't just want to treat pain, but we want to calm people down. We want to get them to relax. Want to help them with their sleep, their digestion. And of course, if you've got an illness, it's very important to get good quality sleep,
Yes.
good quality digestion. Because if we've got good digestion, good nutrition, and we've got good sleep, we can use that to heal and recover and get healthy and get well. So sleep is incredibly important. And so if we stimulate the vagus nerve, we can help with that. So that's really the real bonus of auricular acupuncture over other things.
Wow.
So you'll also get an analgesic response.
Yes.
Response from this, but that vagus nerve stimulus, because that's the only place it's coming to the surface. Now, we can get it in secondary positions, other places in the body, but that's the primary. So that's why we might do some things with that. And interestingly, that was discovered 400 years ago by...
So it's not a new
Not a
thing.
new idea, no. And this was really discovered by a chap called Valsalva. So we have the Valsalva maneuver,
Yeah.
which we use to clear... And he put iced water in the ear, and it altered heart rate and so on to calm people down. So it's not new information. It's not magic. It's just anatomy. It's just physiology. And so when we understand this, as a patient going for treatment, when you see some things like, well, my physio says he's going to put some needles in my ear, and you're thinking, what manner of witchcraft is this? You know? But if we just break it down for a second and we understand the anatomy, okay, well, the nerve's going from here, it's going from the brain, it's going to here, but it's also going here, and it calming everything down. So when we stimulate it, it helps give us another impetus to calm things down. Oh, well, that makes sense now.
Yes.
It seems so crazy anymore. So when we look at facial, similar as well. So we could use facial for facial pain,
Yeah.
for headaches, for migraines, for Bell's palsy, which can be like a paralysis of the facial muscles, for what we would call TMJ, temporomandibular disorders, which are jaw pain, basically. So we can use it for all those things. But we can also use it for aesthetics. Because interestingly, one of the things that acupuncture does when you needle is it stimulates a healing response. Because you put the needle in, it creates a tiny, tiny amount of trauma. The needle, they can be as thin as hairs. The typical size needle that I'd use on the body is 0.25 millimeters in diameter. So it's a quarter of a millimeter in diameter. It's very, very thin. It would fit inside a hypodermic needle. When I needle a face, they get even smaller. 0.16 millimeters is like a hair. And we put those around the eyes, let's say, or around the lines.
Yeah.
And the healing response generates recovery in the tissue. So what happens is it can help regenerate the tissue. That's how we use it for scarring for patients.
For surgical scarring.
Yeah, we can use it for scarring, yeah. I teach acupuncture in a palliative setting as well, and in oncology settings. So we can use that for things like, again, sleep and digestion and pain and anxiety and lots of other facets of that. So we also use it with scarring as well. And we use it in the muscle around the scar to increase range of movement. And we can also use it to help with the quality of the scar and pain with the scar as well. So anything where healing would be a benefit, we can use the needle. Now, again, people might get a little bit confused and think, well, what are we doing needling those things? But of course, we're having other treatments as well. We're not discarding conventional treatment in favor of needling. What we're doing is we're using needling to enhance an effect. And I suppose the bottom line here is anywhere you put a needle, you get trauma.
Yes.
Anywhere you get trauma will stimulate healing.
Blood flow.
So
And the healing. Yeah.
Release of chemicals, which gives us increase in blood flow. That increase in blood flow in itself can be beneficial for that tissue, particularly if we've got an older problem where the body has become less engaged with the healing. What the needling does is it makes it more immediate. So what I tend to say with sometimes with scars or chronic problems is the body's done what it needs to do. You've recovered, it's fine, we'll just move on. It's done what it needs to do and it's quite happy. So that problem has become what I call a then problem. It's a then problem. Your central nervous system is not as interested in it anymore. When you put a needle around a structure, you create an immediacy to it. So you create immediate trauma. It's very, very small trauma, but you create immediate trauma, so you increase the circulation. So you make a then problem, a now problem. And now it's become a now problem. There's an immediacy about it. The body wants to engage with it.
Immediately.
So immediately you start a healing process that has perhaps fallen by the wayside. And that's all we're really talking about when we're talking about those things. Now, if you take that for damaged tissue, you can help healing. If you use it on healthy tissue, it can regenerate it. So we can use it from anything from clinical conditions where people have got problems to aesthetic conditions where people want to improve their complexion.
Wow.
It's just physiology. There's nothing magic about the needle. It's just physiology. If you create trauma, you will get healing. If you get healing, you get regeneration.
Wow, that's very, very simple. Now, the same way, people do use acupuncture for fertility. Give me some insight into it, because I don't do that. I'm not expert in that side of the acupuncture. I would like to learn it from you.
Yeah, so there's different ideas and there's different research and there's different levels of research that show effect on that, depending on which aspect of the fertility you're looking at. So one of the big factors there is potentially influencing the sympathetic system, as we mentioned, the stress response. If your sympathetic system, if your fight and flight system is very elevated, it can potentially cause challenges for fertility. So for some people who are struggling with fertility anyway, whether it's coming from the male or the female aspects of the interaction, that elevation in sympathetic response can cause dysfunctions to different systems in the body. Because if the body's very, very stressed, it makes it difficult to become pregnant, because the body itself is thinking this is a threat situation, it's a dangerous situation, and perhaps bringing a new life into this situation might be challenging. So, it can be very demanding on the body. So we can use acupuncture to, again, calm those systems, to help relaxation, and that potentially can be beneficial. There's some studies on anxiety in pregnancy, and that it can help. Acupuncture has been shown to help with that. There's some studies on things like more physical things like blood flow and so on, and whether it can help with those sorts of things. So there's lots of different aspects that occur with infertility that can limit a successful pregnancy and so on. And it depends what we're interacting with that. So it wouldn't be like, I'm not getting pregnant, acupuncture will solve it. It depends on the physiology, and it's the same with anything else. We always look at what's the pathophysiology of the problem, what's the mechanism of the modality, and the modality is the treatment, and how do these fit together? What's the biological plausibility here? If we think acupuncture is going to help with fertility, what do we think is wrong, and what do we think the acupuncture is going to do? So we don't just throw acupuncture at it and say like, here's your problem. Acupuncture works for this. It's like, well, what are the dimensions that we're looking at? So again, stress, anxiety, blood flow, different aspects of the condition. And so yes, for some conditions it'll work really well. For others, perhaps not. It depends on the nature of your fertility and infertility, and it also depends on how reactive your body is to the treatment, because that's another variable as well. So some people react really strongly because it relies on the release of your chemicals. We're not giving anything to you, which is why there's no side effects. We're creating a stimulus and the body is doing the work. What we're trying to do with a needle is tactically create that stimulus. We're going to get the body to work for us. How do we needle to leverage that effect in your body? And again, which is why I say it's why acupuncture doesn't really have any side effects, because it's your body doing the work. What we've got to do is convince the body it needs to do it,
or trigger in the right place.
So needling in the right place to create the right effect, to leverage that response to make the body work, because it knows how to work. Just for some reason it's not doing that. And if we can interact with it in the right way, so it's not random, depending on the nature of the problem, it's going to depend where we needle. So there's points all over the body. For example, if you are having treatment for fertility, or more commonly overactive bladder, which is another thing. When we look in the world of pelvic health, acupuncture can be incredibly useful for pelvic problems. So if we're looking at things like overactive bladder and so on, male or female, it can be really useful. And people get a little bit confused here, because what happens is we go down and we put the needles in your ankle. And so people look at that and go, hold on a minute, I've got a bladder problem, you're needling my ankle. Well, it comes down to what we were talking about before, reason 4, where the nerves go.
Yeah.
So the nerves that go to your pelvis also have branches that run down the leg. Now the problem is the nerves like to be deep in the body, but what happens is when they get to the knees and the ankle, they have to become superficial, close to the surface, because the bone gets in the way. So what will happen is if we needle next to certain nerves, we can create an effect which can either stir things up or calm things down, depending on what we're trying to do. So if we've got an overactive bladder, we can create a stimulus in the peripheries that calms things down. It's actually referred to as a treatment called PTNS, which is percutaneous tibial nerve stimulation. So some people watching might have had that, where they have a little device on their ankle, has a little needle, puts electrical current in, because sometimes what we do is we run electrical current through the needles.
Yes, electro-acupuncture.
Electro-acupuncture, yeah. And what this does, it just heightens the effect of what we're doing, and by picking certain frequencies, we can tune in that effect a bit more and create more of a stimulus. We can do it very gently. It's not uncomfortable in the slightest. And that's another thing that people ask me is like, well, you put needles in. It's not like an injection. Your clinicians will be very skilled. They'll be able to put that needle in really gently, and then we'll bring that electrical stimulus to where it needs to be, quite subtle, and that will create a stimulus to the right sorts of nerves. And the effect that we're going to get there, hopefully, for an overactive bladder is calm things right down. So that, in conjunction with whatever exercise or lifestyle advice your physio's given you, can be really, really effective for managing that. So not just fertility, but bladder and all sorts of things, hormonal problems.
All the organs we can target.
We can target all these sorts of things. So things like hot flushes. So if you have menopausal hot flushes, one of the issues menopausally is you can potentially produce less of a chemical that's called beta endorphin. And beta endorphin is an opioid that your body produces. And it can also be involved with what we call thermoregulation, which is the ability to control your own body temperature. So if things start to change menopausally, and this could be a natural menopause, or it could be a menopause caused by medication because of other conditions and so on, and we get chemical changes in the body, we can get fluctuations in temperature control, and we can suffer from hot flushes. Now, what acupuncture can do is it causes the release of beta endorphin. But what we can also do is, depending on how your treatment is scheduled, we can actually elevate the baseline production. So not just increase it with treatment, but you can increase the overall level of opioids being produced in your body. So if we can do this to a sufficient level, it can help offset those hot flushes. So again, it's not sandals and candles. It's chemicals versus chemicals in the body. It's biological plausibility, and that's how we can do that. And there's evidence to show these things. So everything I'm talking about,
fully evidence-based.
Evidence-based. Yeah, this is not. None of this is my opinion.
This is another question people get asked me quite often. I have a pacemaker, and which is electrical stimulating the heart. Can we have a electro-acupuncture for that particular patient?
Yeah, potentially you could, but not in the region of the pacemaker.
Yes. But definitely, the pacemaker is here. Can we do it for the legs?
Yeah, we could do it the legs. So what happens, obviously, what we're doing with electroacupuncture is we're using the needles to create two poles, like a positive and a negative to the terminal, which can change their polarity, and the current is running between them. So by inserting the needles into the patient and then connecting them, the current runs through.
The small circuit it will be running.
It's just running between the two poles, the two needles, and as a result of that, we can influence nerves in a certain way. We can influence the chemical response there, because all the cells have a level of electricity in them, so it can excite those to help with healing and so on. It's very subtle. It's a very, very low level, incredibly low level. It's so low, in fact, that if you just held the wire between your fingers and ran the current through it, you wouldn't feel it. The only reason you feel it is because the needle is inserted and the nerves inside pick up a different sensation.
Yes.
On the surface.
Definitely not by the skin.
No, not in the skin. And so as a result there, if you're sighting those needles at the knee, say a patient's got osteoarthritis, and they've got some pain there, and you're thinking, this might be beneficial to do this, but you're worried about the pacemaker, the current is going to run between the needles. So we wouldn't want to put this up by the shoulder
and then to the other side
or down over here, because we wouldn't want the current running through that. As long as we stayed well away
from the
hip, lower back,
shouldn't be a problem. Same way, a patient who are on blood thinners, warfarin or apixaban, where their bloods are quite thin, I'm sure acupuncture shouldn't cause any bleed or damage to the circulatory system.
So what can happen is we're performing what we call an invasive procedure.
Yeah.
So the needle is going into the person. The target that we're putting in, and this is what I talk about, 5 reasons to needle.
Yep.
But I'll also talk about 5 layers of tissue. There are 5 target layers. So we've got skin, adipose tissue, which is the fatty tissue layer underneath the skin, connective tissue, which is tendons and the connective material at the joints. Then we've got muscle, and then we've got bone. So in most cases, we want to put the needle into the muscle.
Yep.
That's like layer 4. Now, this can be very close to the surface. Say, like, if we're looking at the wrist here at the back of the hand, like that's the first 3 layers, and then the 4th layer is just underneath there, so it's very close. Or we could be looking at something over the hip where there's more of layer.
Adipose tissues are there.
Adipose tissue, more fatty tissue there. And so we're further away from our target. Now, what we really need to look at, if a patient is on blood thinners, anticoagulants, anything of that nature, is that potentially we could interact with some very small blood vessels. Now, your physio, your doctor will know where all the big blood vessels are.
Yes,
Same way they know where all the nerves are. So they're very, very skilled. So they're going to avoid all the major blood vessels, which is fine. They know this. Now, some of the more superficial blood vessels, which you can't see and can be a little bit more random in location, we might touch those occasionally with the needle.
Yep.
You might get a tiny, almost like a pinhead kind of like bruise. It's very, very small. Now, if you're on blood thinners, that bruise will be a little bit bigger. Which, if we're looking at the risk-benefit ratio, so I've had this with some patients sometimes where they've had a really beneficial response from acupuncture. More than just pain, it's been very beneficial for multiple problems in their body. But they've then ended up with a heart condition from another problem that they've had and had surgery, and then they're on blood thinners. And so I've spoken to their consultant and said, look, the patient's been having acupuncture, they've now got this problem that you've treated, they've had surgery for, but you want them to take blood thinners because of this problem. Where do I stand with this? And the consultant that I spoke to said, look, the acupuncture has been so effective, I'd really like them to carry on with it for this other condition. And we've just got to accept the fact that in this instance, this patient will bruise if you hit the blood vessel, and that is an acceptable risk relative to their condition, but we really like the benefit of the acupuncture, so we don't want to put that to one side for the sake of bruising. Now, that's a one-off case. Typically, what your clinician will say to you if you come with that is that we're not going to needle deeply. So we're not going to go, not just like past layer 4 muscle, we're not going to the deeper muscle. So if we work through the layers of muscle, you might have 4 or 5 layers of muscle. So 4A, 4B, 4C, 4D. What they're not going to do is go very, very deep down, because then we can't see the blood vessels. And if we hit one of those, you get a little bit more bleeding. It can take a little bit longer. It'll still be fine. There's nothing serious from that. It's just a little bit of bleed, but the bruise will take longer to go away. And because, like you, like I, like your team, we're very conscientious about the total experience for the patient. We don't want them even to have bruising or anything. Not that the bruising will cause a big problem, but we don't want anything like that. So technically we can needle someone who's on blood thinners. We'll decide, along with the patient and potentially any other clinician, if the risk-benefit ratio is entirely in the patient's favour. And if it is, we'll entertain the idea. If it's not, we wouldn't entertain the idea. But the worst thing that we would get is bruising.
That's okay. And same way, as you explained, when we use acupuncture, we are leveraging the healing of the tissue, which the body couldn't do it for various reasons. The same way, polymyalgia rheumatica, fibromyalgia disorders, these are all some chronic conditions where the body hasn't or didn't manage to fix the problem or heal the problem. How does this acupuncture help? Because I've seen so many patients, they love acupuncture, and acupuncture really gives them relief from some of the symptoms.
So I think when we look at the reasons to needle, if we track through the reasons again, this is where we're going to find how and why we're going to use it. As I say, if we understand the why, how it's going to present itself. So we're like, well, how would we use it for this? Let's think about why we would use it. So local healing, local analgesia, the myofascial effect, increasing range of movement in the muscle, the segmental effect going down by the nerve, and the central
effect.
So really where we're going to go is the central effect. So if we've got fibromyalgia, if we've got like sort of polyrheumatica type condition, we've got a central problem here. We've got not just one structure. This isn't about one joint. It's not about one muscle. It's about a global presentation. It may also include stress and anxiety and general pain, and it may affect sleep and other things like that as well, when all these symptoms layer up for those individuals. So it can create a lot of problems. So we'd be looking at acupuncture in the limbs, primarily in the peripheries, in the arms, in the legs, and multiple points. And this will be to leverage that central effect. So we want to release the body's own pain-killing chemicals on a bigger scale as possible, on a larger scale as possible. To do that, we want to move out towards where the nerves are more responsive to that and are more superficial. So this will be the hands and feet. We can layer this, we can add to this by coming up towards the knees and the elbows. Here again, the nerves are coming to the surface at the joint, and then they're going deep again. So you might come in with, say, fibromyalgia, and you've got some neck pain and shoulder pain and maybe some back pain and general joint ache, and you sit down and your physio is needling your hands and feet and your knees and elbows, and again you're thinking, what are you doing here? Again, this is about needling next to the nerves to create a blocking of the pain, and also needling at the distal aspects in the peripheries and the hands and feet to create this, what we call a descending effect of analgesia, of painkillers that your body's producing. So we'll see maybe half a dozen up to a dozen needles put in, and they'll be in for 20 to 30 minutes, and we'll recommend multiple treatments to optimize this, because we can get a cumulative response. So when we have treatment, you can have a dose related response, which occurs as a result of the individual thing that you do, and you can have a cumulative response, and the cumulative response is what happens over time when you keep repeating it, like exercise. So exercise has a cumulative response. You keep doing it, and all of a sudden you find that you're fitter, you're healthy, you're stronger, you're feeling better, you're looking better. And so acupuncture has a cumulative effect as well. So we repeat it over time, and again, your physio will know the duration to do the needles and also the frequency. So when they say, look, I want you to come back twice a week for a couple of weeks, and you're thinking to yourself, well, why do I want to come back for that? Well, here's how the chemicals work. Here's how the physiology works. If we can put the needles in for 20 minutes or so, we can make your opioids a little bit more reactive. If we can repeat this for the first couple of treatments at around about 3 days following, so like average like twice a week, for the first couple of weeks, we can leverage that effect a little bit harder, and we can get a cumulative response, and that does what we call upregulates the opioid production a little bit more, so it makes it a little bit more significant. Rather than it just being related to the dose, it then becomes cumulative, and if we can do that, it's beneficial in the long run for the patient. So let's say we were looking at say like fibromyalgia, and we were going to do 6 treatments. We might be better placed doing twice a week for 3 weeks than once a week for 6 weeks. Get a good hit of the acupuncture close together early on, so we can reduce down some of that pain, and then we can promote and push the exercise, rehabilitation, recovery. We're not going to keep doing acupuncture, and this is what we need to understand. It's not necessarily about keep doing it, because it has an optimal, I suppose, time and space, and has an optimal approach. What we really want to use acupuncture for is enhancing the other things that we do as well. So the exercise, the lifestyle, the management. And that doesn't mean we can't come back to the acupuncture later.
Yes.
But what we don't want to do is we don't want to see this as just a passive thing. The idea is, along with the other stuff that you teach with like lifestyle and so on, and that fits right in there with your lifestyle sort of model, is that we want patients to exercise, we want them to be independent, whether it's osteoarthritis of the knee, whether it's fibromyalgia, whether it's back pain. We want to, educate, and we want to exercise and so on, because that's fundamental. And if we do that, we can improve and enhance quality of life. Because we can improve functional performance. Now, it may be the case that our clients with osteoarthritis of the knee or back pain or fibromyalgia are finding the movement's difficult because there's pain and they're struggling to overcome, and maybe the medication has not been as successful as we hope, and we're looking for other avenues. So we can introduce the acupuncture, and we can have a number of treatments close together, and that can start to promote the body's own painkilling chemicals. And we're going to use that in conjunction with the exercise and lifestyle advice. And if we put all those things together, we're looking to optimize those outcomes. And then we increase the exercise and activity. Now, if somebody has a relapse of their symptoms, let's say symptoms flare up further down the line, this doesn't mean that we wouldn't revisit the acupuncture for an acute phase. Like we said before, can we use it acute and chronic? Well, we can use it acute on chronic as well. So we got a chronic problem,
but a flare up,
yeah,
which is acute condition,
which becomes essentially an acute condition. The patient knows their problem's chronic because they've been living with it. And
so chronic back pain, acute flare up.
We can use it for that. We can have a few sessions, couple of sessions, get them back to their exercise program, and then we move on. And it's always there, so people can always come back to us as a clinician and say, look, last time you treated me, that was great. I had 3 or 4 sessions with that, and then I was able to get back to my exercise. And actually, I've been great for the last 3 years, but I did X, Y, Z, had this flare up. Exactly. Worked for me before. Can we try it again? Now, potentially the answer is yes, but of course, it comes down to the clinician looking at the problem, because this is what we always do. We don't just go, yes, of course you can.
For everything.
For everything. What we do is we have a really good look at the problem, because the dynamics of the problem might have changed.
Yeah, indeed.
A few years have gone on, things might have got worse, things might have got better. So we'll have a good history of what's going on, so we get a really good picture, a really good story of what's going on. We'll find out what the patient's story is, what's going on with them, where best we can help them. And then we'll have a good physical examination, and then we'll make decisions. And if we think in conjunction with the patient and supported by the evidence that this is a good idea, by all means, we'll use it again. But if we now look at it and think, actually, this is a bit of a different problem, I don't think this is what you need today, and the evidence isn't as strong for this, why don't we do this? So potentially we can come back to use it, but it's always going to be about what's best for the patient. So where I put this is what we would call evidence-based practice.
Yes.
Yeah. And evidence-based practice is 3 things. It's the best available external evidence, which is research, it's articles, it's courses we go on, it's interactions with our peers and so on. It's all of those things. And then it's clinician experience. And so working for years and seeing hundreds or even thousands of patients and amassing that knowledge of what works and what doesn't in the real world for individuals. And then we've got the patient preference. And that's very, very important. What works for the patient, what's their story, what's their journey. And then what we've got is all of that held together in what we call an organisational and environmental context. So we might turn up at that problem and be in one setting and have a certain treatment, and we might turn up somewhere else and have a different treatment. And people say, well, hold on, I went here and had this treatment, and I came here and had this treatment. Yes, because in that environment, we could only see you for half an hour, and we can only see you once every 6 weeks. So the best way to treat this was to give you some exercises and advise you. Now, in this environment, we can see you twice a week for the next 6 weeks. In this environment, the best way to treat you now with this organisational environment is this treatment, this treatment, this treatment. So you can see why things might change, but the clinician is always going to be making that best decision based on those 3 variables.
Perfect, thank you. Last question I want to ask you. In what other situations you wouldn't use acupuncture as a treatment for a patient?
Where I wouldn't. Now, this is an interesting one, because this one always raises people's eyebrows, but it shouldn't really. There's only one approach where I'd absolutely never, ever, ever, ever use acupuncture, and that's if the patient didn't want it.
Patient doesn't consent for the treatment.
They do not consent to it because they don't like it, they're not happy with it, it doesn't sit with them.
Needle phobia,
anything like that. If there is no consent, there is no progression of that. And what I'll do is I won't talk anyone into it, and I don't recommend anybody does. So you come to me, you have a problem, we go through your history.
Yep.
We examine you fully, we sit down, we have a really good conversation about what's going on, and I lay out the options for you. And from my experience, I say, well, actually, I would like to do acupuncture, or I think acupuncture, or the evidence from my experience shows this, and we'll put it into context. and I explain it to you, and you say, well, actually, I don't like the idea of that. I'm not even going to say, oh, you wouldn't even consider it. I say, no problem. The other thing we can do is, and I'll move on to the next thing, and that's not what happens. So no one's ever going to get pressured into it. There are things that we consider that things like, say, like we consider things like anticoagulation.
Yes.
We think about certain conditions. We think about the frailty of patients and so on. But we have lots of what we call special populations. So different clinicians will treat different sorts of patients. So if you're a patient who treats, if you're a clinician who treats patients in, say, palliative care, your view of the sort of conditions that you're comfortable treating might be different to a clinician who is in, say, like an outpatient clinic in a sports injury sort of environment, because their clinical experience is different, and that might influence their choice to use certain things. Because obviously, as a clinician, you need to feel confident and competent with the tool that you're using in the environment. So my quick answer is the only thing I wouldn't use it for
when a person don't want
some consent. Everything else I will entertain and consider, but it doesn't mean I would, because I will be looking at that individual, what we call N equals 1. So N is the number of, so when we look at research, we might have a research study that has 400 patients in it. That would be N equals 400. But when we get to clinic, every single patient is an individual. And we use the evidence from all these studies, but we don't just have a blanket approach to a patient. We use that evidence to have an individualized approach to everyone. So we always think N equals 1. So let's just say I'm happy with the idea of using acupuncture for back pain, theoretically. And then 10 patients come into clinic, and they all sit in front of me, and I go through their history. Depending on what their back pain is, I might say no to 9 of them and not acupuncture 9 of them, and I might just acupuncture 1 of them. It really depends on the variables that present, but it's having a good understanding of anatomy, physiology, pathophysiology, and a good history and a good rapport and communication with the patient, so I can understand where they're coming from, what's going on, what they need.
Exactly.
And so that might stop me from doing it for certain conditions.
That's perfect. Wonderful conversation, John.
A pleasure to be here and a pleasure to talk, as you probably appreciate. I like to talk about
It is a fantastic conversation. These are the most questions asked by my own patients, and because loads of them have different questions which never been answered directly, but the in-depth explanation makes a great sense to them. It's a really great conversation. Thank you for your time.
My pleasure. It's, in fact, you can break it down very, very simply. It seems complex. Speak to your clinician. They'll break it down. They're happy to discuss anything.
Of course.
And they always will. So
thank you.
Pleasure to be here. Thanks.
Take care.